Again, thank you so much for joining. Today's topic is on how to master mast cell activation. And one of the things that I put on this particular front page of this webinar is that what is a functional approach to calming your life, but reclaiming your life, right? Many of you out there already listening with this, the reason that you're here is you're completely stuck. You have tried multiple things. You haven't really figured out what that's going to be like in terms of what your complete healing is. You've seen multiple practitioners. They end up having to just give you one or two supplements to see how you're doing. Maybe you have worked with a practitioner, right? And you've tried all different supplements, and it's a very slow process. I get that. And I have clients like that as well. You have to introduce things very slowly, allow the nervous system to self-regulate, to feel calm. And one of the things that I end up having to tell my clients is this, that your nervous system always resorts to what is familiar. If your familiarity of your nervous system is to be in that fight or flight mode, constantly worrying about the environment, constantly worrying about that being sick, then it's going to be so difficult to unwind the nervous system to get to that overall healing, right? I believe now more and more in terms of working with different clients and over the years developing my approach, that's not about the overall microbiome issue. It's not about the mast cell issues either. There's a deeper issue in terms of spirituality as well as in dealing with the subconscious level that we have to get to that level of healing that you need. And so it's not just about working with me, but you may have to do some mind body work and such. And we'll discuss more about it and reason why I implement certain programs into my clients' overall healing. So I want you to say goodbye to the sensitivity, fear, and reclaim your life so you could live again. I want you to enjoy your life. There is a light at the end of the tunnel, basically. Okay. So congratulations for taking the time to join this workshop. And the fact that you're here tells me that you are dealing with severe sensitivity issues, right? You have multiple things going on, symptoms-wise, unexplainable issues, right? You're here because you have severe food sensitivity problem, limiting you to only eating maybe a handful of tolerable food, as well as you've been to several doctors, functional practitioners including, and all of them end up having to prescribe different pharmaceutical drugs. Nothing's working. And you cannot tolerate supplements at all. It's limiting you to what you could start with. I get that. And I do work with those clients as well. So costs of living with mast activation or chronic illness in general, it's not just about the buying of supplements or seeing different doctors for that matter, right? There is definitely medical expenses going on, treatment costs, yes, but time costs at the same time. What does a time cost look like? Time costs of taking time off work, managing and tracking symptoms, right? You also have to be there for your family. That's also difficult. Dietary and lifestyle adjustment, physical discomfort you're dealing with, chronic pain, fatigue, GI issues, respiratory or cardiovascular symptoms, environmental, and then mental health is the biggest impact you're going through. Why? Because you don't know how you're going to react to a certain environment. For that matter, if you could even go outside and then enjoy interacting with your friends and family, right? And constantly have to explain to them what that is, right? So there's a social cost, there's a professional cost in that sense of that, right? I had a client who's doing much better right now, but he couldn't leave his apartment. He had to be stuck in that apartment for almost a year. And you know what actually helped him to get out? Having COVID, because he couldn't smell a single thing out of his nose because he has so much congestion that he was able to go outside and then enjoy for the first time. And then once that COVID symptoms died off, he started having reactions again. So he was quite happy for a short period of time. But again, there's a social and a professional cost of dealing with this. So who is this workshop not for? If you're not dealing with any chronic issues, then you are on a wrong webinar. So I want you to just leave. Okay, just leave. If you're not dealing with any issues, just leave. This is for people dealing with severe issues only. Okay, and it's a big promise today. So I want to share with you, you can break out of that health prison and live your life and still manage your condition. It's an ongoing process. And I'm not going to lie that your chronic issues or even mast cell issues are going to go away in 6 months. Sometimes that's not possible. It may take about a year or even 2 years to get through it. But the overall thing that I end up having to tell my clients is this: as long as you could see 1% improvement on a daily basis, that improvement accumulates to a bigger things that you could see. I just had a call with my client today. She had a mast cell activation as well as post-COVID problem. She couldn't get out of her fight or flight state for a long period of time. But the stuff that I'm going to be discussing about tonight, I worked with her, right? And now, after 5 months, not a day difference in terms of what she could tolerate, the food that she could eat, the type of activities she could do now, right? No more POTS, to a point that she could end up having to now jump around. Huge difference, right? But 5 months ago, she couldn't picture what that was going to look like for her, right? So, including yourself at this point in time, if you don't see that particular healing possible, I want you to get out of that limitation and think about what could be possible. And I hope this webinar is able to unlock different things for you to help you. So if you stay until the very end, I'm going to give you some valuable information. I'm also going to give you some free gift of foundational medicine protocol. This protocol may not work with a lot of people, but some of the key lifestyle aspect of it, you could still implement. So that's one thing, but I'm also going to share with you a heavily discounted one-on-one consultation program as well. This is much more than my regular 45-minute consultation. But I want to learn more about you. I'm quite sure you work with different practitioners and you have multiple labs for me to review. So this will be the time to discuss about that. So I will be offering that later on. So for myself, if you don't know me, my name is Dr. John Kim. I'm a functional medicine pharmacist, been in clinical practice for 16 years. My real mission is to empower you basically to be your own best doctor, because the doctor of the future is you. And my credibility is that I'm a 16 years of history of clinical practice, managing complex cases. And one of the things that I could do very well, I'm talking very humbly, is that I could connect with clients and fixing the root cause issues in relations to cell membrane, but also as well as root cause aspect of it. I mentioned about subconscious level and such, right? So, as you probably know my history, I had a heart attack back in 2015, and I thought I was living a very healthy life. I thought I had a perfect laugh, but unfortunately, I had an 85% blockage in my artery. It's called a lower anterior descending artery. It's called a widowmaker, and even the cardiologist at that point in time in the ER couldn't believe what I was dealing with. And once I got into the cath lab and they found out I had an 85% blockage, and being that I became the youngest patient to actually get a stent put in that hospital, was a very surprising thing that I found myself, but also my doctor, and just completely shocked everybody. So after that, I tried to figure out what the issues were. And so I went to my doctor, my integrative doctor, and started asking questions. And I thought I was just getting a regular IV vitamin C to just help with my energy. But unfortunately, my doctor's like, you're dealing with much deeper problem. Maybe you have some kind of infection stressors that could be a potential cause. So after a month wait, that's when my test came back. I was test positive for Bartonella infection, mycoplasma, mold toxicity, as well as Epstein-Barr. And the diagnosis was that I had an undiagnosed hidden stealth infection with mold toxins may have contributed to my cardiac presentation. So after 2 years of treatment, going through the root cause, now it's almost 10 years actually. I forgot to update this number. Almost 10 years actually being infectious free. and having to have a better freedom of eating food, as well as immune balancing that was achieved, have a better mental and freedom I gained, as well as found new motivation to empower people. So just a night and day difference in terms of the skin complexion. This is not just me. People who actually have a healthy cellular health, you could tell right away by just looking at their skin. The skin's a lot brighter, their eyes are much sharp, and so you know that person is healthier than before. So some of the hidden issues that I was ignoring during that time is that I had very bad breath and I didn't realize how bad it was, right? Some people end up having to comment how bad it was, but again, I didn't realize how bad it was. But to a point, how that having to do with leaky gut and mold issues and yeast overgrowth was connected to my cardiovascular issues, right? As well as I was constantly bloating when I had ate meat, high fiber meals, forget about it. I was constipated all the time, heartburn, cystic acne, all of my body, including my face, my chin, anxiety off the roof, insomnia. And all these things end up having to disappear after tackling the root cause problem. But I didn't. Actually, I'm dealing with it now, right? After learning more about it myself, that I didn't actually address my childhood trauma, as was my nervous system dysregulation and ongoing work in terms of self-regulating. I grew up in a very abusive household, right? And I didn't realize how much of an impact that goes on to your HPA axis, and I have to cause a immune dysregulation on top of nervous system being dysregulated and becoming an entry point for different pathogens to come in and causing a lot of issues. I also have a severe skin sensitivity as well. I still live with it. I have something called a dermatographia, where if you end up having to just scratch my arm lightly, I blow up like a balloon. That is a histamine response, right? That could be a mini mast cell activation issue as well, right? So I live with the issue. I also have trauma problem that I'm still dealing with, right? But I'm able to proudly say a lot of pathogenic issues has been completely cleared out, but it's still ongoing process even after 10 years, right? So this is the part that I didn't figure out until recently, that if I address the subconscious, if I address the issue dealing with nervous system dysregulation, that the healing becomes a lot easier for people to get unstuck from the chronic issues you're dealing with. So what I learned from that is this, that complete healing is possible without using pharmaceuticals. Secondly, getting to the root cause and address the mitochondrial dysfunction, phospholipid issues that the patient might be dealing with. So cell membrane damage is a big one. But the third thing that I found out is that nervous system dysregulation must be addressed, right? And that could be from the trauma aspect that you receive as a child, but it could be deeper issue in terms of generational trauma. The start issue that you're dealing with didn't happen at that point in time, right? Trauma aspect of it, having to deal with anxiety issues, having to change the epigenetic profile of people, right? Give you an example of Ashkenazi Jews dealing with Holocaust and the trauma aspect of that coming to deal with, right? A lot of the Ashkenazi Jews actually have GI problem, anxiety issues as well. Why? Why? Because of trauma, the generational trauma that comes through. So there's a running joke saying that, a lot of Jewish people end up going to become a gastroenterologist because they have gut issues they got to fix on their own, right? It sounds funny, but many cases it's not, because they also deal with the trauma. And we have to get to the subconscious level of these things to gain the overall healing. And I want you to take that message very clear today, and that gaining health freedom is possible. So you might be thinking, right? You might be thinking that complete healing is not possible without using complicated pharmaceutical drugs. And you have come to terms of accepting the problem. And this is not good. This is not good at all, right? And I went to several specialists and they all said the same thing. Or I don't have the time right now to even deal with my symptoms and having to live with the discomfort. And I'm willing to live with the missed opportunity being not healthy. Or the last thing could be I don't have the motivation to fix my issues. That's not where you want to be, right? That's creating your own problem. And if that is your overall mindset, I don't care how much money you're spending. I don't care how many practitioners you go to. You're just going to be stuck in that same mindset, same issue, same symptoms over and over and over again. And that's not how you want to live. I want you to think bigger possibilities tonight by learning what I'm going to be sharing with you. So, three key to success in managing MCAS is number one, you must be coachable and willing to take action. If you're not willing to try different things and also helping to regulate your nervous system in trying the new things, and this is where I coach my clients in doing this, it's not possible to succeed, right? Also, second, you must focus on the progress. You don't have to be perfect. Focus on the 1% improvement you make on a daily basis. And third, you must commit to never letting the self-doubt to stop you from what you want to have, right? You cannot have self-doubt. Yes, the symptoms might be happening up and down, but are you progressing to a better future? If that's the case, don't doubt. It's just a progress. I've been there, right? Just kind of give you an example. When I was dealing with my own health issue, I was almost bedridden for 4 months. I could not get out of bed. And I get that. And people out there, if you deal with it, I understand what you're going through because I've been there. It sucks. I get it, right? People are able to do whatever they want to, but then you are stuck being sick. And I've been there. Okay. So I get that. So just because conventional medicine does not recognize your pain and sometimes might call you crazy, you're not crazy. And I get you. And so the healing isn't impossible with functional medicine, but I want you to go even deeper in doing it and look at the root cause aspect of it. And this basically literally saved my life. So you could do this, right? I went through my own health journey. I was scared, right? Finance wise, self doubt, missed opportunities to be with friends and family, etc. I get it. One solid thing I'll share now is that I trust in the process and knew it was part of my season to heal. So when you get to the top of the mountain, you're able to see what you were able to achieve and see a bigger horizon. That's literally what healing is like. So before we start about mast cell activation, I want to share about what cell danger response is and how that's all related to this whole thing called mast cell activation. So cell danger response is a metabolic response to protecting yourself, your cells from harm, right? So how does that get triggered? What is cell danger response and how does that be triggered? Triggered by chemical, physical, or biological toxins. What are they? Biological could be viruses, bacteria, fungi, parasites, right? This is the main things that a lot of healthcare professionals on Instagram end up having to talk about, right? It's true, but there's a bigger issue right now going on, right? Chemicals, heavy metals, as well as EMF. There's volatile gases that you might be reactive to, right? Flame retardants, all different things, including herbicide and pesticides and all different things. And then there are physical issues such as heat, salt, pH changes, right? You might be reacting to the sun if you end up having to go out too long, right? All those are part of the cell danger response that could occur and triggering your mitochondria as well as your immune cells, but your nervous system being fired up, trying to deal with the changes that goes on because you're in a survival mode. And this is what a lot of people end up having to live when you deal with mast cell activation. Another thing, and that we end up having to not remembering is that it's not just about the physical issue, that there's a psychological component that comes into play. What is that? Physical, emotional, psychological traumas leading into repercussions, childhood development problem, family dynamic. So now when I'm working with clients dealing with MCAS, I ask them how their childhood was, right? How their family dynamic was. There are studies showing that if your mother did not meet your overall emotional needs and providing a safe environment, that in itself causing so much HPA axis activation and dealing with stress that it can lead into autoimmune issues, right? So it's just not about the biological issues. That's just one component of it. But as of in terms of looking at the entire ovary health, you cannot blame everything on the mold problem. You cannot blame everything on the viral issues, but there's a already underlying problem subconsciously, right? That's been embedded that's causing the different things to occur. And that's part of the cell danger response, right? It's not just about the pathogens, but the cell danger response occurs because your body does not feel safe, right? So this is the problem that we're trying to uncover. So when you go through the CDR response or cell danger response, the mitochondria alters the energy production to shielding the further injury, leading into a down regulation. So what happens? You feel fatigue, right? You have lack of energy, depression kicks in. And then the mitochondria senses all threats and goes into an overall fighting mode, right? So why doesn't some of these supplements like glutathione or B vitamins don't work well? Why? Because your mitochondria is really shutting things down, trying to protect you from the problem, and then you're trying to reactivate the problem while giving up supplements. So is a supplement the way to do it? Not many people could tolerate that. So all these issues dealing with autism, ADD, PTSD, anxiety disorder, mental health issues, right? Chronic fatigue syndrome, PCOS, all these are related to cell danger response and how that comes into play. So there's a deeper rooted issue. So what is mast cell activation? Well, mast cell activation is not about the histamine problem. It's about an inappropriate release of chemical mediators from the mast cell, right? About majority of the white, about 10% of the white blood cell is comprised of mast cell, and that's what it does. It releases different mediators, not just about histamine, so commonly mistaken for histamine intolerance, and that's not the case. And histamine is a major component of MCAS, but it's just a piece of the puzzle, and that histamine intolerance is just a subset of MCAS. I hope that makes it very clear that just taking antihistamine is not going to fix the problem. So what is the root cause of the MCAS? I told about the underlying issue could be bacterial, viral, fungal issues, heavy metals and herbicide, mold illness, including allergens, genetic predisposition. So especially if you have NTHFR gene issues, then that could be a big component of that problem. Or if you have a genetic SNP and not able to handle a DAO enzyme very well, that could be also issue dealing with breaking down certain histamines as well as certain mediators. Childhood development issues such as trauma and family dynamic. And this is the key thing there. There's not a single root cause issue. It's going to, and addressing that is going to take away the MCAS right away. That's why it's such a hard thing to deal with. So in MCAS, addressing the single source of the possible root cause will not fix the problem. And this is where, including myself, have to be getting stuck on and thinking that, oh, if I address the mold problem, everything's going to go away. No, there's an underlying deeper issue that comes into play that could end up having to cause severity of this MCAS, right? And there are certain people who are not even able to drink water properly. Right? I've had that client before, and that's something that is even bigger problem because now I got to figure out what food you could eat, right? And certain people who are able to have a minor issues MCAS and able to get out of it very quickly. But key thing is this, that it must include a holistic, comprehensive support in order to heal from MCAS. So triggers of MCAS, non-food related issues, extreme temperature, right? So some of these patients with dealing with MCAS, I would never recommend them doing a cold shower, never alone doing ice bath. That's not what you want to do. That could actually trigger even more stress response. Wrong thing to do. But what is all the social media happening right now, right? Hot and cold therapy is so good, but for people dealing with MCAS, that's not right, right? Exposure to certain mold and Lyme disease, emotional stress, insect bites, chemicals in certain personal products. So if you are not having the right ways of finding out which skincare products you could use, just message me after this. I'll be happy to share a certain product. I've been starting using this protocol, Healthy eSol, healthy and then Y and then Sol, SOL. They use tallow, olive oil, and honey as their soap component. It's great. It doesn't cause any issues. It could actually help with the eczema problem you might be dealing with, and it doesn't dry your skin. Is perfect. I love it. And then I started using tallow-based skincare product as well, and that's been really helpful for a lot of people. That's the thing. And then medication that liberates a histamine or blocks down, especially Benadryl, can trigger mast activation even greater than anything else. So I'd rather go with, you know, H1 blockers like Zyzol, for instance, to help with histamine response instead of doing Benadryl. Benadryl is also an anticholinergic effect, and so it can cause severity of dryness and triggering other issues in the body. So I don't really recommend Benadryl at all. Sodium benzoate. Sodium benzoate could be prevalent in common things such as food preservative, right? Certain snacks can contain sodium benzoate as well. Sodium benzoate has been shown to cause severe issue dealing with ADD in kids. So you gotta take that away. But that's another thing that could trigger airborne issues such as chemical smoke, heavy metal toxicity, um, and as was arsenic, are known to causing mast cell to be destable. Anesthetics, stress. I didn't put EMF, but EMF could be another thing as well. High histamine food that you want to avoid: yeast and alcohol, dairy. I don't care what kind of dairy you're eating. Fermented dairy such as kefir, aged cheese, yogurt, sour cream, including raw milk, can actually trigger a lot of mast cell issues. So I would avoid those. Gluten, fermented foods such as sauerkraut, kombucha, miso. Everybody loves recommending fermented food. MCAS patient, definitely not, right? This is why it gets so tough to recommend different things. Cured or smoked meat, fish, bone broth is no good. It causes high histamine response to occur. It could literally throw you off into mast cell issues. So don't recommend that. Ground meat can also release all that histamine as well. So if you could find a local farmer that actually, after butchering, cools down the meat and then freeze the meat right away, the overall histamine response will be less, right? So that's something that you gotta have to figure out where you're getting your meat from. I know for sure, companies like REP that I like to recommend people to do. They tend to have a very clean process of butchering their meat and dealing with that. So that could be a thing, but usually I don't recommend ground meat as much. I would like to at least have you eat a whole meat, such as steak for that matter, or something along that line. I would not recommend chicken. Chicken can cause a lot of histamine response. Pork can cause a lot of histamine response. So stay away from those at the same time. Shellfish, citrus fruits such as lemon, lime, and oranges, vinegar, leftover aged food. If you're gonna save food, I'd rather have you freeze it and then heat it the following day. But if you're gonna leave it in a regular refrigerator, probably avoid that issue as well. Certain berries, strawberries and raspberries, do contain oxalates, and oxalates are something that I don't recommend for patients dealing with MCAS. And if you are my client, I explained to you thoroughly why you don't eat oxalates containing food. Chocolate is another thing. Nuts, especially cashews and peanuts, That's including almonds, walnuts. Those all contain oxalates as well. So mast cell and mediators, what are those? So when there's a immune reactivation, immune activation that goes on, the granules within the mast cell releases chemical mediators. So again, it's not just about the histamine. It end up having to releasing histamine, tryptase, heparin, prostaglandins, leukotrienes, and such, including heavy bouts of cytokine activity that just to target the histamine is not going to fix the MCAS problem, right? So this is the reason why testing modality has to be done correctly in order to rule things out. So these are some of the newer things I added onto the lab profile just to see what are the issues the patient might be dealing with. But this is very important to rule things out to see if there's any additional mediators being released because of this response. Who is at risk? Risk factors: immune dysfunction from chronic infections, toxin exposures, repeated allergen exposure, genetic variation, especially if you deal with MTHFR issues and having methylation problem. COMT is another problem as well. If you have trouble breaking down histamine correctly, especially if a Dow genetic SNP, that could be another problem as well. But third thing I've been mentioning about the subconscious level, hyperactivity to the HPA axis due to childhood trauma, sexual trauma, or poor family dynamics can really be a huge risk factor to this problem. Statistic-wise, highly prevalent in women. Common age of onset could start as young as 9 years old, and diagnosis often take decades. And the single approach versus 3D approach, single approach of dealing with pathogens and trying to clear that out does not work very well. And so in terms of the entirety of how to help patients deal with MCAS, the complete picture, looking at more of a 3D approach is a better way to do this, and I'll explain more on this. The symptoms dealing with MCAS, right? Multiple issues here, right? Systemically, you're fatigued, sensitive to food and medication, respiratory issues, neurological, mental, emotional, right? Decreased concentration, memory, anxiety, depression. There could be certain triggers that causes anxiety issues to occur. Musculoskeletal issues, especially if you're dealing with EDS, right? That could be a genetic issues dealing with this. There's about 10% variation causing hypermobility because of genetic, but this could be all related to MCAS issues that to a point that you have poor collagen process that goes on, which is causing your joint to be hypermobile. Digestive issues. I also deal with hypermobility as well. My joints are super flexible since I was a kid, right? And I didn't realize that versus the histamine response that I'm living with, how that is all part of the MCAS issue, but it's just a minor, right? But there's a variation of it. Can you live with it? Could be. But if you are not able to live your life fully, that's a problem, right? So again, this is just to educate you at this point in time, and hopefully this is really eye-opening in terms of what you're dealing with. Um, Digestive issues, skin, digestive-wise, GERD, especially if you're doing severe heartburn. Sometimes you might have to use PPIs or other drugs for that matter for at least 6 months to a year until the mast cell issues has been under control. So you can't just get rid of the medication right away. And there's nothing wrong with utilizing pharmaceutical drugs to control the issues you're dealing with, right? Skin, flushing, itching, hives, cardiovascular issues such as high or low blood pressure, lightheadedness, racing heartbeat, right? And then irritable bladder, interstitial cystitis issues. There's a lot of women dealing with interstitial cystitis issues, right? It's all part of MCAS. So common issues that could be coming into play: chronic inflammatory response syndrome, right? Irritable bowel disorder, gut dysbiosis. Why? Gut is actually rich in mast cell and home over 70% of the immune system, right? 70% of the immune system starts with the gut. And this is the problem. And so if you're dealing with parasites, bacteria, fungi, and multiple issues, sorry for to put virus there, uh, that can trigger gut-related mast cell issues. And this is where um, uh, histidio can actually be very helpful to deal with these things, such as like to supplement it together when you're eating something. That's another thing. Obesity, if you have trouble losing weight constantly, having to deal with reactions to supplements and food, could be MCAS, diabetes, asthma, right? Autoimmune disease, internal candida problem, right? Look at this. All this are chronic issues that people commonly dealing with, but these are commonly associated with MCAS, right? Including fibromyalgia, fungal infections, tinnitus, multiple sclerosis, cancer, right? Infertility. So the first thing I want to address is the importance of methylation process. And this is the part that could be a little bit of problem where we think we could just randomly throw something at it to help deal with the methylation process. Now, the methylation MCAS is a complex matters and is a huge relationship to histamine response. So immune reaction plus not able to detox very well, and there's a cell membrane damage. The underlying issue dealing with methylation problem can be even bigger. That's the reason why you have trouble detoxing mold, having trouble detoxing heavy metals and such, and the role of a genetic SNP like MTHFR and methylation process and histamine metabolism is also interlinked as well. Deeper issues to unravel the role of the enzyme problem and genetic mutation, right? There's epigenetic issues. And so there's certain protocols that I put together with patients. I do not use any methyl B vitamins right off the bat. I do not. I don't. Why? Because there's an underlying cell danger response that's occurring that you have to get to that first before you could even start methylating correctly. Because your body's constantly stuck in that mode. So, in certain cases, personalized genetic testing needs to be done in a complicated scenario. And then the digestive issues as well, gastrointestinal tract, especially concentration of mast cell in the gut I mentioned about, contribution dealing with heartburn, nausea, vomiting, constipation. I had a client who's constantly having to deal with tingling sensation in her mouth if you end up having to start certain supplement. That could occur. That's mast cell issues there, right? There's a deeper, it's not just about histamine, there's a deeper immune, right? Mediators end up having to be released that sometimes just utilizing antihistamines may not be helping. So what's helping for some people? To allow them to feel comfortable trying new things. When the nervous system feels safe, the symptoms dealing with mast cell sometimes disappears. That's a little trick that I end up having to implement with a lot of clients. That I tell them to hold on to that supplement and tell your nervous system that this is safe to try. This is okay. And it sometimes works. May not work for everybody, but it does work for some people. And that you could start utilizing different supplements that way. You may not be able to connect and utilize everything, but sometimes that could be something that could unravel a lot of issues. Research findings that 66% of the patients dealing with digestive issues have MCAS, and SIBO present in 31% of the patients as well. MCAS and Lyme disease are all interrelated. What does that mean? Pathogens contribute to mast cell activation, right? Lyme can actually activate mast cell, and MCAS symptoms end up having to overlap with Lyme disease. So you don't know which one to fix. But in order to be effective in terms of clearing out the Lyme, you need to address the MCAS first before you do Lyme disease. So if your practitioner has not seen that, you're constantly running with a problem that you haven't really addressed yet. So these are 5 discovery things I'm going to share with you tonight. The first thing you need to do is you need to address the nervous system to start the healing process. You need to calm the cell danger response. It's not about giving you body bio supplements, right? I love giving out body bio and recommending because it helps a lot, but that's not the first thing that you could tolerate sometimes, right? Sometimes just having a little drop of body by PC completely throw you off. Why? It's not the fact that the PC is causing Herx reaction. That's not the case. PC or phospholipids are chemical signals, right? It acts as a chemical signal in the body. So it starts to act on and reacting different ways in terms of turning things on in the body. But if your body is in a stuck mode, it's not able to turn that on, it's like trying to crank a broken engine. It's not going to work. Matter of fact, you may end up having to damage even more. So you need to calm the nervous system, and we will address it more and more on this part. But address the nervous system by utilizing what? I didn't say anything about supplements here, right? Light therapy, right? I love utilizing Neurovisor these days. This is an impulse light. I have a friend who's on this call right now. She tried it. She really didn't like it, she says. But it's a fascinating tool. Impulse light with sound help to increase BDNF and neuroplasticity. Brain tap is another item as well. So if you want to spend about $700 to $800 on investing in these machines, could be very helpful as well. Mind body work, you have to work with a practitioner. One thing that I implement with my clients, and I should give them as a free gift if you work with me in a 6-month program, I give you the HeartMath device. Why is that so helpful? Is that your heart coherency shows you the level of stress response you're dealing with, but also shows you the resiliency to handle that stress. The more resilience you have, the less of a symptoms you might be dealing with MCAS, right? So what did we do today before we start? I asked you to think about what your overall healing was going to look like in the next 6 months. And I asked you what that feels like. What did you do at that point in time? You created heart coherency by what? Focusing on what is positive, what is loving, what could be happy with, right? So you shifted that internal nervous system to a heart coherency. That's a powerful tool that you just did in 30 seconds. Imagine trying to do that for 5 to 10 minutes, even 20 minutes, twice a day, right? Incorporation of the breathwork technique that I teach, humongous change that goes on in people's lives, right? Also trauma resolution as well. Second discovery is that holistic approach to healing has to be done methodically, must be multifaceted healing, right? It's not just about giving supplements and call it a day. I give much more detailed instruction on these things and teach my clients into doing deeper lifestyle and other things that I'm going to share with you tonight, right? Addressing the diet, emotional well-being, and environmental factors. If your environment does not feel safe, if you're constantly living in a moldy house, MCAS is not going to go away, right? So you're going to have to focus on how to create a healing environment for you. Various tools to meet the individual needs. Therapy must not and cannot just target pathogens until the nervous system feels safe, right? There's certain people who cannot take any supplements. It takes them months to unravel that process, right? And so this is an important part. Environmental exposures, creating a safe environment I mentioned about, and patient environment. You should read the book called The Body Keeps a Score. It's written by Dr. Vanderkolk. It actually shows a lot about how trauma impact the body, right? And if you believe that not thinking about your trauma is what the sign of healing is, that's not the case. You're basically suppressing your trauma. That doesn't help out. I was one of them until I end up having to face my issues and trying to deal with it on my and then working with a therapist, end up having to be the biggest impact that I had on my own in the last 3 years, right? Discovery number 3, impact of early experiences, the role of family dynamics and traumas in shaping physical and mental responses, including importance of resolving early development issues for better health outcomes, right? So now with new clients I work with now dealing with MCAS, I actually give them now a form to fill out whether you're dealing with sexual trauma, family trauma, right? Were you neglected as a child and such? I didn't realize my mom having to uh, go through a divorce when I was 2 years old, and then on top of watching her leave me when I was 4 years old because she had to come to the United States to study. My grandparents raised me, but I didn't realize how much of an impact that went on my nervous system, right? And then on top of having to grow up in a very um, traumatic experiences at age of 9 to 11 years old, right? Having to watch my mom getting abused, and then even for myself at that point in time, physically, emotionally, and mentally abused at that point in time, how that impacts my overall nervous system, and is in that process, right? Called hyper HPA axis activity causes leaky gut that entail causing different immune modulations to occur, and then having to have an opening way for different things like different pathogens like mold, parasites, right? How that's all interrelated. That's the reason why I had a lot of leaky gut. I didn't realize what that was, right? So I'm telling you at this point in time, if you're dealing with different things that you haven't really able to figure out, if you haven't addressed their early childhood, and not saying that everybody dealing with MCAS have early childhood experience issues, right? Because the last client that I had a meeting with, she does have MCAS problem, but that was due to vaccine inducing problem, right? She has a loving family, but after she got COVID-19 vaccine, and MCAS ended up having to trigger that problem and having to deal with this, right? So not everybody deals with early childhood problem, but this is something that needs to be addressed if you're dealing with it, right? So mental health and physical symptoms must be addressed. And also, talk therapy do not work, okay? Do not work. This is the reason why somatic work, this is the reason why heart math, light therapy, right? Sometimes use of different chemical modalities like ketamine, right? That could be some things that needs to be addressed to deal with the trauma issues, right? So that's the thing. And some people don't even know they're dealing with this kind of traumas because they were too young to recognize it. But your body knows. Your body knows. Number four, light therapy and circadian rhythm changes. This is the biggest impact that I've made implementing this to my clients, and they are seeing a huge difference in terms of their nervous system. The reason that I'm actually wearing this blue light blocking glasses is because if I constantly get exposed to blue light, that also affects my nervous system. And I didn't realize how impact that was until I started wearing this more and more, at least 3 to 4 hours before I go to sleep. And then my nervous system started to calm, able to get a better sleep in that sense. So healing technique must be matched to the body, to the circadian rhythm. You need to block out all blue light. Okay, if you're constantly working in front of a computer, that doesn't help you in this process of dealing with MCAS. So this is the reason why you want to promote, you want to invest in these type of glasses. So one of the glasses that I started using is from EMR Tech. You could use my code, you could go to our website. Bond charges and other glasses as well. I found out that EMR Tech tends to be $20-$30 cheaper and is a higher quality lens compared to Bond charge. So that's the reason why I'm recommending this. But that's something that you should be wearing. You should be getting this as well as a light yellow glasses as well. So this way, if you're constantly looking at the monitor or there's a different blue light going on, or fluorescent light for that matter, you need to wear these things to help you calm your nervous system. And especially if you're dealing with severe MCAS and nothing worked, this may work for you. But you have to be really committed to doing this, blocking out all blue light and basically living in darkness at night. Like especially when the sun goes down, you should be at home blocking out all the lights, right? If you could invest in those red lights at home, you should use that, but you should be in a complete darkness for about 3 to 4 hours before you go to sleep to allow proper circadian rhythm changes. And you should wake up between 5:30 and 6 a.m. and look at the sun. You need natural light. You need natural light. If you have if you're living in a different environment where you cannot, that's not possible, investing in a red light therapy panel could be great. So EMR Tech, I just recently got it, is a vitamin D with red light therapy panel all built in. Oh my God, the night and day differences of how I feel after doing that in the morning has been tremendous for me. And especially for me, I cannot absorb vitamin D orally. So the panel has been great. So again, visit EMR Tech, look at their panels, invest in one of these things if you could afford it. If not, no worries. Just go outside. You have free modalities of getting red light. Okay. Just make sure to block out all the artificial light around you, including your monitors as well, right? Sorry, I'm kind of hit the wrong button here. And the benefit of light therapy in managing chronic illness, blue light versus methylation pathway. So what does that sound like? Why does blue light and methylation have to do with anything? But here's a key point that I want you to teach you today. This really important topic that I'm really excited about is that blue light, in conjunction with turning the riboflavin context in helping the methylation pathway and the methylation detoxification and clearance of heavy metals, and through the methionine cycle, and it sounds very complex, is that blue light blocks methylation process. It's through the entire methionine pathway that turns on in your eyes. It's just that if you're constantly staring at an artificial light and not working on the circadian rhythm, this is probably the reason why you're constantly stuck all the time, right? So if people deal with MCAS issue, what happens? They sometimes get stuck in the house and not have the proper ways of actually managing light therapy and such, and or light exposure. That could be preventing you from methylating correctly, right? This is really important. This is the reason why that's number 4 that I started implementing on my patients. No more blue light. Discovery number 5, dietary considerations. Starting on a carnivore or modified paleo diet. And modify meaning getting rid of all the offending issues, such as oxalates, right? Oxalates is a huge, huge problem, right? As well as certain things like tomatoes or nightshade vegetables, a big one that I get rid of as well. And you got to look at what kind of oil that you use, or fat for that matter. But this could be a little difficult if you're dealing with alpha-gal. And I've had 3 clients so far deal with an MCAS, but it's been so difficult to manage their diet because of Lyme disease that induce alpha-gal symptoms occur. They cannot eat any red meat. So they're stuck eating chicken or just fish alone. Obviously, there's still enough, but not as densely nutrient meal that I want them to have. So it's been very challenging, but patients are being very compliant and managing it, and they feel much better because of that reason. I recommend doing grass-fed regenerative farm beef, bison, or venison for that matter. If tolerated, seasonal eating is best. So especially during the summer, if you could eat seasonal fruits and vegetables, if you could tolerate it, great. If not, don't worry about it. You get to a point where you could eat that. And also importance of food and stool analysis to identify sensitivity is key thing here. So I know I sometimes say that I'm not a big fan of stool sensitivity testing. This is when you use it properly, okay? So not just about ordering just for the sake of ordering, but when you are limited in terms of how to help your client out, food sensitivity can be a big, powerful tool. So let's remember why you're here. You feel bloated. You're constantly having to react to food. You constantly have the runs and you can't just seem to control your symptoms. You're sick and tired of not finding the right doctor, accepting the issues and living with it. It doesn't seem very fair. You're tired of explaining to people you have sensitivity problem and constantly suffering from symptoms of MCAS, nervous system dysfunction, GI issues, you name it, you have it. So I want to share with you one of the successful case I just concluded with my client. Within 5 months, I was able to help this patient out greatly. So 35 years old, he came in, did a one-on-one consult. He was working with another practitioner. Nothing helped out even after a year of treatment. We assessed his diet, stress triggers, and full medical history, and various anxiety. And he was a nervous individual. You could tell right away when you had to see them. And oh, sorry, I kind of skipped that slide there. And then the patient was constantly dealing with uh, complaining of mold. He actually lived in a moldy environment before. Acid reflux constantly happening, chronic diarrhea, severe food sensitivity issues. So he was already limited in terms of what he could eat, and severe onset of esophagitis issues. Esophagitis could be stemming from mast cell issues as well. Why? Because it affects the mucosal tissue. And when you have mast cell issues, an immune-related problem, your phospholipid reserve goes down in the mucosal tissue. So you're more likely to deal with esophagitis for that purpose. Okay. And patients actually had H. pylori, and the previous practitioner saw that he had H. pylori, and she said, you could live with it. It's going to go away by its own. No, you got to fix that ahead. You can't be just leaving it alone, right? So initially worked with so we ordered additional tests. We did an update stool testing as well as did a red blood cell fatty acid analysis. And this is something that I do with my clients who work with me in a 6-month concierge model that we do order these things. Did not run a food sensitivity because he was limited in budget, but implemented a full carnivore diet, right? That was hard for him to do, even though he could eat meat, but he was constantly not comfortable just eating meat itself, even though he was already limited in terms of what he could eat. So it took a little while, but now he's able to tolerate a lot of food. So after finding that he has severe mold and H. pylori problem, we found out that he had high levels of trichothecins, which is a black mold, gliotoxin, zonulin, ochratoxin, and aflatoxin, and he had trouble absorbing fat, and he also had leaky gut as well. So mold issue-wise, mold triggers mast cell activation. It's not the fact that the mold is the root cause of the problem, but mold can trigger a lot of these issues dealing with mast cell symptoms, right? So, especially for dealing with a black mold like trichothecins, affects the DNA and RNA, so it actually can embed into the cell membrane, including the DNA, and change the function of your organs as well. It can also lead into inflammation, damage to blood vessels, compromise the immune system, and then GI issues. Gliotoxins cause intracellular function problem, immune issues. So when you're working with me and dealing with gliotoxins, I have a specific method and ways in terms of clearing the gliotoxin out, including black mold, even before we could work on different ways in terms of change the microbiome. But you have to be obviously ready for that. But there's certain ways in terms of I work with clients on these things. Zonulin mimics estrogen. So he had very high levels of estrogen-like symptoms in guys. Aflatoxin is very commonly found in food, but also can be found in moldy buildings. It can bind to DNA, affecting protein structures. So if you have high levels of aflatoxin, including trichothecins, you may not be able to digest and process amino acid properly. So there could be muscle loss going on as well. So red blood cell fatty acid analysis, this is very, very important study I look at with patients. I implement this particular test to all of my patients dealing with chronic issues, especially if you're dealing MCAS. I want to see the level of fatty acid deficiencies, but is there demyelination? Is there fatty acid structural damage that goes on? Is there any other structural deficiency that goes on? Especially palmitic, and these type of things could be replaced by simple food. But it's just that if you're malnourished, also could be a problem. But looking at this point in time with this client, he has low levels of omega-3, omega-6, and then his cell membrane is completely stuck. So this is a patient who's dealing with severe severe cell danger response, but also dealing with severe. So we look at all different things here. I'm not going to explain a lot of things here because obviously it's going to take a lot of time, but I do look at the levels of arachidonic acid and so how much of inflammation you're dealing with, but also looking at Nirvanic, which is showing that there's a high levels of neuroinflammation going on and such. And I do implement this to all my clients who I work together. So root cause treatment, much deeper issues after seen. We target the mold and H. pylori, antimicrobial herbs, and repair and replace. This was an easy case because he didn't have a severe MCAS issues, but was able to get through this process. Really the mentality and anxiety issue took a little while. It's doing much better at this point in time, but constant coaching process to helping him, right? And also literally hand holding this process of getting through it and replacing proper restoration of phospholipid, fats, and essential fatty acid, utilization of heart coherency to help with the mind-body connection, and then as well as a light therapy really helped out. So before joining, this was a level of mold that we saw, and this was literally 5 months before. Now, this is test results. He still has a little bit of issue left, right? Because the mold issue has not been completely cleared out, but 9-day difference in terms of after 5 months of working with me, right? Why? How did this occur? How was this possible? Because of complete healing process, the total body reset program that I implement my clients that really helped out doing